over time. Technology has advanced substantially.
We're going to see some things that are absolutely incomprehensible to us right now.
The sky is the limit for the future of medical technology.
Everything's always changing.
You always have to try to think 5 years ahead.
We may see that we don't end up implanting metal implants in people anymore. It might be biological implants.
Everybody's shimmering with glee about the prospects of being able to recreate whole organs.
And there will be these small little robots that go into your system and do the surgery themselves.
There'll be a new specialty that will replace the traditional open heart kind of surgeries.
My ultimate vision would be try to identify a patient that's predisposed to a cancer, a patient that will develop a cancer because of their genetic makeup, and prevent it.
So I'm really excited about the iPhone, the iPad, some of those new technologies that will make our workers truly mobile.
The foundation needs to be and wants to be always at the leading edge, or even creating the state-of-the-art for the hospital and for the community.
The foundation helps provide the tools needed for these physicians to express their art.
We have the technology to be able to bring these new drugs in and monitor them and know whether they're improving or not.
Because we have the technology, we have attracted several world-class physicians to Sarasota Memorial. We have the infrastructure to support them.
We've had an electronic medical record for about 12 years.
The Da Vinci is just, it's an extremely expensive piece of equipment, but it allows patients to have minimally invasive surgeries.
The incisions have dropped by a third or a quarter of what they used to be. Recovery times, which were months to years, are now weeks.
The foundation's visionary, and they say, if we bring this robot in, we can not only use it for these indications, but maybe we can explore it down the road and see where it's going to play out.
The goal is to make sure that they have the tools that they need to do their job. And predominantly those tools relate to technology and education.
There are small costs like screwdrivers, saws, which are only in the thousands of dollars. And then there are larger costs like computer equipment in the hundreds of thousands of dollars.
Learning something new and a new way to treat someone or a disease is based on observation.
It's an expensive process to bring new drugs in, to monitor them, to get the reputation you need.
We want to be very budget conscious. We're very careful on how we spend our money and very, very careful on how we invest the donor's money.
If you're interested in quality of life, then this is the investment.
By donating to the foundation, people will not only potentially help themselves by some of the trials that we're doing here in the hospital, but they may also be helping their children or their grandchildren.
You can't live in the present. There is no present, because within a second, you're in the future.
If we don't maintain that cutting-edge technology, we may not maintain that edge in giving the best care.
ENVISION, from my perspective, is how we can always be at the leading edge